While Nigeria is struggling to contain a Lassa fever outbreak in the country. More than 100 people have died in January and Feb, and there have been more than 5,600 suspected cases of the disease this year. Health experts are urging the government to accelerate efforts in tackling the disease while also working towards vaccines. DD India's correspondent Ajak Magut reports.
James Bulus is storing harvested guinea corn in this tiny shop. He's putting down poison to keep vermin away from his grains.
We are worried about getting Lassa fever because we store our farm produce at home, and there are a lot of rats that come in here.
Food contaminated by infected rats causes Lassa fever, an acute viral hemorrhagic disease. Nigeria has had outbreaks of the virus since the first case was recorded in the late 1960s. Health authorities say more than half of Nigeria's 36 states have recorded at least one case of the disease this year.
We're losing a lot of healthcare workers. We are losing innocent people in the rural areas who come into contact with these, rodents, which is the carrier of the virus. Most diseases that are related with vectors and also with change in climate and increase in population are usually very difficult to control.
Nigeria's Center for Disease Control says public health emergency operation centers have been activated at both national and state level to respond to cases. This involves the detection and monitoring of outbreaks, lab testing, public education and personal hygiene, food safety and rodent control in homes and workplaces. Experts argue that the government needs to improve these measures while it works to get vaccines available.
What Nigerian government needs to do to effectively control Lassa fever is to, first of all, strengthen surveillance and then increase our capability to treat cases. At the same time, to improve risk communication with those living in hotspots in highly endemic areas, and rapid movement to acquire this vaccine.
There's currently no available shot against Lassa fever, but Nigeria's government says it is working to develop one.
Officials at the Ministry of Health say a special task force comprising the Nigeria Center for Disease Control, the National Agency for Food and Drug Administration and Control, and foreign partners are already conducting studies on the disease, but it could take years for a vaccine to materialize.
Until then, Nigerians like James will have to keep doing what they can to protect themselves against the virus. Ajak Magut in Abuja, reporting for DD India.